Hi, I'm Bob Bartonetti. This is my wife Karen, and we're here to talk about stem cells therapy. And I'll go back to when I got hurt. I was struck by a car on a freeway 25 years ago, and I was a pedestrian. I got hit, and so my life changed at that time from being a very physical, active person to where it took me probably about 3 years of treatments and attention just to be able to normally walk and get back into my life. At that time, I started seeing doctors for the process of getting better, and I went through a lot of different injections, a lot of medication, and it took 25 years is when I finally came upon the stem cell therapy. So I'd gone through some epidurals, I've gone through ablations. I've let doctors do a lot of different things to me, try to find the source of my problems and cure my back injuries. Unfortunately, I never had a broken bone, so there wasn't anything on an MRI or a X-ray to treat. So through the years, the therapy that I got, that I talked about, and also medications, I was able to live my life but not back to the level of what I was before my injury. And through all that, I came to the stem cell therapy through my wife Karen and going to one of their seminars, and didn't really know what to think about it when I heard about the therapy. But as we were sitting there, I had just had ablations done about 2 days prior to that seminar, and when they talked about the stem cells revitalizing and regenerating factors and the process of it, it struck me, a chord in me, and I talked to Karen about it, that here I'd had ablations where they killed the nerves in my back, and knowing good and well that they would grow back and they would regenerate, it just didn't make sense to me, especially because I was still in pain, that I was doing that as opposed to the stem cells and their therapy in rejuvenating the what do I want to say there, the nerve endings. So we came in and met with stem cell therapy with Dr. Whitney and his crew here and all of his staff, and we were really still apprehensive, not having a lot of knowledge about it, and we made the choice to do it, and I have had a remarkable improvement. It's the first thing that's I've ever had done that it really cured or got me to a point of being close to being cured of my injuries. At the peak of my injuries and my treatments with doctors, I was taking up to 400 milligrams of either OxyContin or morphine sulfate, and I'm now taking 30 milligrams of morphine sulfate, and it's still something that I hope to get to where I don't have to use it, but after 25 years of being on it, I've still got a little bit of I won't say I need it just to kind of get me through the day. It takes a little bit of the lasting pain and anxiety of the injury away from me, but the therapy that I've got from the stem cell it's hard to explain after 25 years. We've gone through a lot of different things with our lives, and just having to accommodate my pain and get through it, and it definitely, it wasn't excuse me, it wasn't immediate day of the injection that I felt the relief, but over about a week's time we came back for a second session, and at that time I was able to tell Dr. Whitney of the improvements that I had, and that the pain was almost completely gone. Now, I've had other situations through I got these 8 or 9 months ago, the therapy, the stem cell, and in that time I've had a few times when my back hurt, but it never went back to the pain that I had before the stem cells, which really impresses me. So I'm really happy with it, and I know it's a big step to take. It's probably the best choice I ever made. At the time, it didn't seem that way because as you've probably seen or heard, the insurance doesn't cover it at this time. hopefully down the road insurance will be a factor in this therapy, and hopefully that's what more people getting it, that the government or the doctors or the system will find that that's what's needed in pain therapy. So for me, this has been the best thing that's happened to me in the last 25 years as far as my physical body is gone. So.
Well, I didn't realize how much his pain affected me until he didn't have it anymore. And it affected every single part of my life. And so I'm rejoicing that he doesn't have the pain, and I couldn't say enough about how good it is.
Perfect. And so when you say that it has changed drastically, what is it exactly that you used to worry about always and that you don't have to anymore?
That he wouldn't be able to do whatever we were doing, whatever we were trying to do. And it's like, I'm still getting used to it. Let's put it that way. That's how much it affected my life. I'm like, really?
We can go on a hike. Yay!
You want to go for a walk?
Good, good. Well, that was beautiful, you two. Thank you so much. Do you have anything else to add?
No, I'm all right.
Yeah.
All right,
Okay.
there it goes.